Dr. Pooja, are you there? Dr. Pooja? Who is sharing screen? Dr. Pooja? Dr. Pooja Kadambe, are you there? Please unmute yourself and talk with me. Dr. Pooja?
Ma'am, am I audible?
Yes, audible. Okay.
Yes, ma'am.
Dr. Padmaja, are you there? Dr. Padmaja Joshi?
Yes, ma'am. I am there.
Okay, okay.
Good afternoon, everyone.
Good afternoon, ma'am. Then Dr. Rucha? Dr. Rucha Ganu?
Yes, I am there.
Okay.
Good afternoon, ma'am.
Good afternoon. Dr. Shobhana Pandey?
Yes, ma'am. I'm there. Good afternoon.
Good afternoon. Dr. Rizwana Sheikh? Okay. So now we can start our meeting.
Good afternoon, ma'am.
Yes, good afternoon. So, good afternoon to all and welcome on behalf of Maharashtra University of Health Sciences, Nashik. Myself, Dr. Karli Gitanjali, and I'm from Ayush Department of Maharashtra University of Health Sciences. So, today's case is we have started from last session, we have started antenatal care series, and this is second lecture. And today's topic is hyperemesis gravida. For that, we have Dr. Pooja Kadambe. She is PG scholar from Guru Mishri Homeopathic Medical College, Jalna. So, I will request to Dr. Pooja, please share your screen to present today's case.
Ma'am, screen.
Yeah, your screen is visible, but your audio is low.
Good afternoon, ma'am. Good afternoon, everyone. Respected teachers and all PG students and MHS members. Uh, today's topic is a case presentation on hyperemesis gravida.
Pooja, just go ahead. No problem.
Yes, ma'am. Actually, there is some technical issue.
Just scroll down. Scroll down your PPT. You have not opened properly in PPT. Just that is problem. So, but no worries. Okay, just scroll down. Yes. Okay. So second slide, we can.
Yeah. Preliminary data. Name of the patient, this is XYZ, with the age 24 years, gender female, address Jalna. Duration of marriage is 1 year, height is 154 centimeter. Then weight is 48 kg. Period of gestation is 9 weeks, primary gravida. Last menstrual period is 1st of April 2023 and expected date of delivery is 8th of January 2024. With chief complaint, she was having a pain in the lower abdomen. Vomiting after eating is increased since 4 days. In morning, nauseative feeling and all over day nauseative feeling present. Then retching in the morning with giddiness and associated complaint, the difficulty in passing stool, has to stay in for stool since 1 week. No appetite and weak. History of chief complaint, vomiting, onset sudden, duration since 4 days, sensation all day nauseative feeling after eating food, even smell of food. Then modality after aggravated after eating and in morning and better by taking rest. In obstetric history, abortion is 0, preterm 1 and gravida is 1. Menstrual history, amenorrhea since 2 months with the last menstrual of period 1st of April 2020. Then past history, nothing specific in past history. General examination, temperature 98.2 degree Fahrenheit of February, with respiration 18 per minute. Pulse rate is 72 beat per minute.
Yeah, your voice is low, little bit low.
Okay.
Yeah.
Hello.
Yes, now it is okay.
Continue.
Yeah.
Pulse is 72 beat per minute. Pallor is present.
Continue. No,
Okay.
no.
Tongue moist and pale. Pallor conjunctiva pale is present. Then skin is healthy. Hair brown. Nail bed pale present. Edema on leg absent. With investigation, hematological investigation, date of investigation is 5th of June 2023. CBC, complete blood count, HB percent is 9 gram percent. With a total leukocyte count is 9.9 into 1000 cell per cubic millimeter. Then platelets is 270 lakh cells per cubic millimeter. Then blood group BRH positive, PDRL is non-reactive, HBsH is negative, HIV1 and HIV2 is non-reactive. Random BSL is a 110 milligram per DL. Then investigation in USG done on gravid uterus on 5th of June 2023 with gestational age of fetus 9 weeks and 2 days. The survey uterus anteverted bulky showing single gestational sac at fundus, margins regular, no subchorionic hematoma, yolk sac seen, then fetal pole seen, then CRL 33 mm, cardiac activity is present, fetal heart sound is regular, 170 beat per minute. Then expected date of delivery is 8th of January 2024. This is USG report. with differential diagnosis with case in the acute gastroenteritis with symptom in a acute gastroenteritis with diarrhea, stomach cramp, then belching, gagging, indigestion with a nausea, vomiting, and flatulence. In acute appendicitis, there is a colicky pain in the central abdominal pain with the migration of pain in the right iliac fossa with the diarrhea, nausea, and vomiting. In cholecystitis, sharp cramping or dull pain in the upper right center abdomen pain will spread to the right shoulder or back with nausea, vomiting, and fever. And in peptic ulcer diseases, there is burning in stomach, feeling of fullness, bloating in abdomen, then intolerance of fatty food, heartburn, nausea, vomiting with a black color vomiting. And final diagnosis is a hyperemesis gravidarum in primigravida with a 9 week of gestation. It is a severe type of vomiting in pregnancy and got effect on the health of mother. The symptom of vomiting occur throughout a day. Vomiting frequency is more with retching and loss of appetite and weakness. Thank you.
Okay, thank you, Pooja. Nice case presentation. Now to discuss case, we have Dr. Padmaja Joshi. She is professor from Dr. Vasantrao Pawar Medical College, Nashik. Welcome, ma'am. Dr. Padmaja Joshi.
Hello, welcome, ma'am.
Yeah.
I have some problem with my camera, I think so. But am I audible?
Yeah, you are audible. Can you share your slides?
Yes, ma'am. Yes.
Yeah.
Is it visible, ma'am?
Yes, yes, yes. It is visible.
Shall I start?
Yes, ma'am. Please start.
Before that, I really appreciate presentation by Dr. Pooja. She has nicely presented the case, and she has covered almost all points regarding the case. 2-3 points I wanted to clarify. One thing was in obstetric score, where she has written abortion 0, para 1, gravida 1. So I think you should make one correction over there, that it is a gravida 1. Whenever patient is pregnant, we don't count it in the parity. So just correct it as only gravida, primigravida. Okay. Otherwise, everything is very fine. So coming to the topic, hyperemesis gravidarum, as she rightly said, that what do you mean by hyperemesis? Emesis is vomiting, and hyper means increase. Hyperemesis and gravidarum means in pregnancy. So it is a severe type of vomiting which has got deleterious effect on health of a mother and which incapacitates her to do a day-to-day activity. Okay. So what are the effects of severe vomiting? As non-pregnant state, we just consider all these effects like dehydration, metabolic acidosis if the starvation is for long time, alkalosis, electrolyte imbalance, and weight loss. And why we are more worried? Because she is carrying a baby, so it should not affect the health of the baby also. But take it from me that baby is a parasite. Even if patient doesn't consume much, but baby, whatever it is required, baby extracts from maternal stores. Only thing, if the vomiting is severe for a longer duration, the ketones which are produced in the maternal body may hamper the development of the fetus. So coming to etiology part, why it happens? The main culprit is the hormone HCG, human chorionic gonadotropin. This human chorionic gonadotropin has effect all those effects related to pregnancy. Mainly, it is the MSS or pregnancy-induced vomiting. So, what happens? There are multiple factors why it happens. It mainly it happens in first trimester because the beta HCG levels are very high in first trimester. Generally, it starts at the time of confirmation, fertilization, and after or so on, it goes on increasing, and it is at peak at around 10 weeks. So mainly patient has more complaint between 8 weeks to 12 weeks. The peak is at 10 weeks. Initially, this beta HCG is produced by corpus luteum, and afterwards it is taken over by the placenta. So the at 10 weeks, what happens? The placenta is working, and little bit of corpus luteum is also contributing to the beta HCG level. And because of that, the levels are very high, and the side effects of beta HCG then lady experiences. So first thing, it is because of HCG level. It is more in first pregnancy because the some kind of antigenic factor from paternal side contributes to this effect. It has got a familial tendency. The genes are not known, but some kind of family history is always there. Second thing, the more the beta HCG level, the higher will be the MSS effect. If the multifetal gestation is there, if the twins are there, or hydatidiform mole means vesicular mole is there, these pregnancies have got high effect or high level of beta HCG, and because of that, the pregnancy vomiting is more common in unplanned pregnancies. It is just an incidental finding that it is more common in this thing, unplanned rather than planned. What are the theories behind that? As just we discussed, is the increased HCG level. Second is high level of estrogen, high level of progesterone. All hormones at a higher level or peak during pregnancy. Thyroxine is at peak, prolactin, adrenocortical hormone. In that, second hormone important is progesterone, where progesterone decreases gut motility. It has effect of on the gut as slowing down the bowel peristalsis. So what happens? The lady will experience constipation. At the same time, the progesterone relaxes lower esophageal sphincter, the sphincter between esophagus and the stomach. Because of that, the lady will experience regurg or retching or so. So these are the effects of progesterone plus HCG. Even thyroid, because the alpha component of beta HCG and alpha component of thyroid TSH are similar, only beta components are different. So it has got the same effect on the thyroid stimulation also. So many a time we experience thyrotoxicosis in such patient, or pregnancy with thyrotoxicosis experience more amount of vomiting and hyperemesis gravidarum. Some psychological factors are there. If the lady is engrossed, or it is she is overburdened in her day-to-day activities, if she is not supported psychologically by the family, and she is not able to take diet adequately, hence many a times she is hypoglycemic, and because of hypoglycemia sometimes regurg and acidity gets more or increased. So that may be one of the reason. If she is not getting adequate rest, then the rebound or reflection comes towards MSS gravidarum. So if she is not in a comfortable atmosphere at either working place or at home, then also it may get aggravated. Dietary deficiencies like vitamin B6, B1 also can aggravate this hyperemesis. Even some immunological factors may increase the hyperemesis gravidarum. Gastric motility decreased is because of effect of progesterone. And after 12 weeks, the beta HCG level gets steadied, and because of declining beta HCG level, and then they come to plateau. Because of that, then the effect of beta HCG, that is vomiting, it goes away, and once first trimester is crossed, the lady will be relieved from those emesis factor or hyperemesis factor. Coming to clinical presentation, generally the management point of view, we consider early management and late management. If it is controlled with early measures, then we will not see the long term and major side effects. So considering that early treatment part, the vomiting, what generally what is the pattern of vomiting? Morning sickness is the most commonly observed pattern of vomiting in hyperemesis gravidarum. So why? Because the patient is lying down at night for a longer duration. The lower esophageal sphincter is open because of higher level of progesterone. So there is a factor of regurg, and because of that regurg, whenever patient will get down, get out of the bed, first thing she will feel to vomit. So what we suggest is early intake of food at night, avoid late night eating. At least she should be in upright position for at least 2 hours after dinner. At whenever she gets up in the morning, we ask patient not to sit, lie down for a moment. She can have porous food items like thari or toast or biscuit. She can consume that, so that those biscuits and whatever porous items will absorb the acid secretion which is collected in the esophagus, so that the first bout of vomiting can be prevented. So initially we advise just simple measures. Then after eating that biscuit, then she will sit, then she will be there. She can take deep breath, म्हणजे आपण मराठीत दीर्घ श्वसन म्हणतो तसं आम्ही त्यांना करायला सांगतो. आणि तिचं एक सायकोलॉजी काम डाऊन झाल्यानंतर मग आम्ही तिला सांगतो की तू आता तुझ्या ऍक्टिव्हिटीज सुरू कर. Then she can brush her teeth and all those things. So one thing is that. Second thing, curtail all the food items which those stimulate her nausea feeling. Many a times people say की मला त्या फोडणीचा वास आला. 95 times females are complaining about vomiting episode after that फोडणीचा वास येणं, की लगेच रिगॉर्ज येतो. काही त्या पेशंट एका स्पेसिफिक कलरला नॉशिया येतो. कधी कधी आम्ही प्रोजेस्ट्रॉनच्या टॅबलेट देतो, त्या प्रोजेस्ट्रॉनच्या कॅप्सूलच्या येलोइश कलरचा नॉशिया आला, ती गोळी बघितल्यावर मला नॉशियाटिक फील येतो असं सांगतात. तो certain food items or certain activities which will increase her nausea or vomiting, we ask them just to curtail them. Okay, she has to maintain her food. We always counsel the patient and family that once she is pregnant, the whole family is behind. She should take a balanced diet, and every 3 hours she has to take anything or ये खाओ वो खाओ, पोळीच खायला पाहिजे, हे नको ते नको, सगळं सुरू होतं. So what we say, maintain your 24 hours diet. It doesn't mean that तू आता पोळी 2 पोळ्या जेवणात खाल्ल्याच पाहिजे. Whatever you like you can have. Only thing, homemade food should be there. Plenty of fruits, if you want to take, you can take. Mainly nausea is for liquids, and because of that these females get dehydrated. So in some kind of other juice, milkshake, whatever she wants, she can have. हम तो बताते हैं तुम्हें अभी जो खाने का मन करे वो खाओ. Just avoid prostaglandin releasing food items like papaya or so. So whatever you want you can have. There is no balanced diet in first trimester. Have plenty of fruits, add on salads and sprouts. So whatever is needed will be sufficient, and additionally whatever you want you can have. So dietary modification is required in initially. Many a times 80% problems are covered because of this simple thing. The symptoms, as she discussed, vomiting, retching. So because of dehydration the urine output goes down. Epigastric pain, it is because of esophagitis, because of repeated vomiting. So she may experience spells of retching, or during peristalsis she may have burning sensation in the retrosternal period area, and constipation because of progesterone effect. So coming to signs, as she has already discussed everything, the tongue will be dry because of dehydration, eyes will be sunken, and acetone smell in the breath. Mainly if she's starvated for longer duration, what happens? The fats are broken down for energy and they are converted into ketones. So acetone smell in breath we observe. There will be tachycardia, there will be hypotension, there will be dehydration, fever, and jaundice might be a late sign, but these are very late phenomenon. If milder cases, she will only complain of vomiting, retching, decreased urine output, and dehydration. But in late stages, she may have other system involvement also. So diagnosis initially, you have to first confirm pregnancy. One thing, as I said, hydatidiform mole and multifetal gestation has to be ruled out at the time of confirmation of pregnancy. So डबल है ट्विंस है तो हाइपर एमएसएस एमएसएस ज्यादा होने वाला. डबल दो प्रेगनेंसी more beta HCG, more hyper emesis will there. So that has to be confirmed. Then coming to investigation part, as she has already discussed, the urine analysis mainly will be concentrated, high specific gravity, and ketones. Ketones is the important thing. What we do urine analysis. If the ketones are not there, then we manage the patient at home by some dietary modification, by counseling, and by some medications. But if the ketones are there in the urine, then I think it is a sign that you should admit the patient and you should replenish the water loss in the body. So that is important. And rest of the things are biochemical and circulatory change. Accordingly, you will have to screen all the systems. And retinal hemorrhage is the rare phenomenon, so she need to check for that also if she is having some vision related issues. The concern, the dangerous complications are like this. If the hyperemesis gravidarum is not controlled at all, if the lady doesn't approach the healthcare system and homemade recipe treatments are going on, then very rare cases we have seen some patients with Wernicke's NK, pontine myelinolysis, which are very rare, but I have seen 2 patients of pontine myelinolysis because of long-term starvation in pregnancy, Korsakoff psychosis, stress ulcers in stomach, esophagitis and followed by esophageal tears, jaundice, convulsions, coma, and renal failure. I have seen 2-3 patients of renal failure also because of long-term starvation in pregnancy. So these are very dangerous complications, but these are very rare. So coming to treatment part, just we discussed as vomiting, control of vomiting by counseling, changing food habit, and some medications. So that medications we will discuss later on. And mainly, as I said, if there are ketones, if the patient is not able to retain any food item, बरेच वेळा पेशंट सांगतात खाल्लं की लगेच व्हॉमिटिंग होते, पोटात काहीच जात नाही. मग अशा वेळी इफ शी इज नॉट एबल टू रिटर्न एनिथिंग, then it is, I think, high time to admit the patient for at least 48 hours. It has got dual benefit. One is change in atmosphere. Many a times by changing the atmosphere and climate, many a times it helps. Second thing, keep it completely NBM. Keep the patient NBM for 48 hours and replenish the dehydration with IV fluids. Okay, that is very important because her kidneys should flush the ketones out, because those ketones, if remain in the body, may affect the development of the fetus. So the ketones should be flushed from the urine. So fluid intake either orally, but if she's having severe vomiting, then give IV fluids. Then correct the metabolic disturbances and prevent the complications. So what we do, we hospitalize the patient, we keep the patient NBM for 48 hours, first at least 24 hours, because of whenever she will take from mouth, it will rebound. So that we should give the GI time for healing, that esophagus time for healing. So NBM, give IV fluids. Generally 2.5 to 3 liters of IV fluids are advised. In that, 1 pint for sugar intake for dextrose, and then RLNS by ton we give the IV fluids. One thing, replenish or relieve that dehydration. That is the most important thing. If patient is free of vomiting for 24 hours, then you can ask her to take small liquid, first clear liquids, then soft, and then regular diet. In addition to that, we can add antiemetics like promethazine, prochlorperazine, triflupromazine, hydrocortisol, and so on. But generally, what we use is doxylamine in combination with B6 and B12. It helps a lot. Many brands are there. The age-old brand is Doxinate, or so many brands are there. One thing, if the vomiting is severe, you can add ondansetron for time being, not for a longer duration, but just to finish that acute episode, you can advise her for 2 to 3 days. After that, you stop. Many a times we have to add mucin gel to soothe her esophagus and that GI to prevent that ulcer formation. And then IV fluids and just assurance and antiemetic, that is the treatment. If with that also she is not able to cope up, then we may have to switch her for parenteral nutrition, because the long-term starvation has got detrimental effect on her body also and the development of fetus also. So in that situation, very rarely we have those options with us, but 99.99% these things definitely help us. In addition to that, whatever cause of hyperemesis has to be screened. In addition to pregnancy, if she is having thyrotoxicosis and because of that her vomiting is more, then thyroid correction is needed. If she is having peptic ulcers or type A personality to start with before pregnancy, then generally people with type A personality have such complaints more than the normal usual population. So counseling part is very important. Assurance is second thing, and the third one is the medication. I think this is from my side, ma'am.
Thank you, ma'am. Very nice and detailed presentation for hyperemesis. Please stay with us for question and answer session.
Yes, ma'am. Yes, ma'am.
So next we have Dr. Bucha Ganu. She is associate professor from Tilak Ayurvedic College, Pune. Dr. Bucha from Ayurveda.
Yes, am I audible, madam?
Yeah, you are audible.
Okay.
You can share your screen.
Actually, Dr. Joshi, madam, has almost covered everything. So I would like to add some points by Ayurveda therapy.
Ma'am, Pankaj ma'am, you can stop your screen share. And please stay with us.
It's fine, madam. I am not going to share my screen or PPT. I will only speak some things regarding Ayurveda
Okay.
in hyperemesis.
Then please turn on your video. We are eager to see
Okay.
on screen. Yes. Yes.
Is it fine? Okay. Yes. First of all, I would like to congratulate Dr. Pooja. She has.
Adjust your camera, please.
Okay.
Yeah.
Yes. First of all, I would like to congratulate Dr. Pooja. She has presented very well. And Dr. Joshi, madam, has already covered every point of hyperemesis regarding the conventional treatment. Being an Ayurvedic practitioner, we are practicing Ayurveda therapy in Tarachan Hospital in Pune. We also practice conventional medicine. We use doxylamine, we use promethazine, metoclopramide, ondansetron. Still, patient is having complaints of vomiting in pregnancy. In Ayurveda, there are some medicinal things which can be used in vomiting. That is the mashi kalpana, in which we roast the drug up to it turns carbon black, and it is given with the help of honey to the patient during daytime, 1 hour, half hour or so. So the mashi kalpana is used in Ayurveda therapy. The results we get are very promising with that mashi kalpana. We use cardamom, that is veldoda. So elaichi, we use that for mashi kalpana because elaichi is decreasing the acidity, and the mashi kalpana helps in absorbing the fluid content of the vomitus, or which is going to entrap in the stomach. So it helps in the vomiting of pregnancy. And the smell of cardamom is also very nice. So patient also feels has a pleasant also feels pleasant. Second time, for soothing of the esophagus and gastric part, we can use pomegranate juice like dadima, we call it as. If we give it in little quantity, spoon by spoon, it helps the patient to relieve from the gastritis or the hyperacidity the patient is suffering from. Similarly, we use laja manda, that is puffed rice we use, and we use the manda is one of the method we use. That is, the water is boiled and we put the puffed rice in that water, and then just we turn off the gas, and the puffed rice, it is like a normal saline. So the electrolyte imbalance is also covered with the help of laja manda, and the patient is also she gets relief from the vomiting she is having pregnancy, and she is prevented from getting dehydrated. So these three things we are regularly using in our hospital, in Tarachan Hospital in Pune. In most of the cases, I have seen that when the patient comes in second trimester for registration and she is having fetal growth retardation, if we take proper history, we come to know that she was having intractable vomiting or hyperemesis in first trimester. So once the pathology of fetal growth retardation sets, it is very difficult to revert the patient from that pathology. So when the patient is complaining of vomiting, we have to treat, because it is going to cause fetal growth retardation in her second trimester or third trimester, which is going to land up in deleterious effect of that fetus. These are few things which I would like to add. Rest of all, madam has already said everything in her presentation. So I think I can stop here.
Okay, thank you, ma'am. Now for homeopathic expert opinion, we have Shobna Pandey. She is associate professor and HOD from Gynec department from Ahmednagar Homeopathic Medical College.
Good evening, madam. Good evening to all present in this meeting, in this online clinical meeting of antenatal care. which is organized by MEHS and conducted by Ayush Department, MEHS Nashik. Dr. Padmaja Joshi Madam and Dr. Rucha Gonu Madam, they have tried to cover most of the points. Even I would like to share a few points from my PPT. Error. PDF. Okay. Error. They want PDF. Okay, ma'am. I have some problem with my PPT. Some document as PDF to be shared. Now, as we know, in antenatal care, that is the systemic supervision, which is the examination advice of a woman during pregnancy, which we call as antenatal care. And hyperemesis gravidarum, it is the severe vomiting in pregnancy, which causes deleterious effect on the mother as well as the baby. So hyper means
Ma'am, can I share
more.
this?
Actually, I cannot present my PPT
No, I will try.
on my.
Just a minute.
Okay, madam. Okay.
Is it visible?
Yes, ma'am. Thank you. Thank you so much.
Yeah.
So, thank you for giving me an expert faculty as an expert faculty in this clinical online meeting. Myself, Dr. Shobna Pandey from Ahmednagar Homeopathic Medical College, Ahmednagar. Now, antenatal care, it is a okay, antenatal care, it is the systemic supervision which can include examination and advice given to the female during pregnancy. So, in antenatal care, whenever we come across hyperemesis gravidarum, it is a severe vomiting in pregnancy which has got deleterious effect on the health of the mother, and it incapacitates the female in her day-to-day activities. Hyper means more, gravida emesis means vomiting, and gravida, that is vomiting during pregnancy. Now, whenever we see a female that she has a common complaint of morning sickness during pregnancy, this morning sickness is common and it is not hazardous to the female as well as fetus. But when it becomes severe form, it is termed as hyperemesis gravidarum. Now, etiology of hyperemesis gravidarum, that is the rising hormone levels, especially HCG hormone, that is human chorionic gonadotropin hormone, which increases during pregnancy. This HCG increases more in twin pregnancy and in molar pregnancy, that is hydatidiform mole or vesicular mole, same. Then in first pregnancy also there are chances of hyperemesis gravidarum. Then many a times,
Ma'am?
am I audible, ma'am?
Yeah, you are audible, but this is repetition.
Okay.
So can we directly jump?
Okay, we can go ahead. Yes, we can go ahead. Same, the causes are same, etiology is the same. Then this is the severe nausea and vomiting with indigestion. Diagnostic point, whenever there is history of nausea and vomiting, there is family history. Many a times we see that female says that she was having history of hyperemesis gravidarum in her previous pregnancies. If she is second gravida, third gravida, so on. Then many a times it is that physical examination, when we go for physical examination, we see that the female has weight loss. Around 5% of weight loss may be seen, and we have to do investigations like blood and urine examination, which Joshi ma'am have already told us in detail. And if we found some changes, we have to take care. Then in USG, USG is necessary to confirm the pregnancy and to rule out multiple pregnancy as well as hydatidiform mole. Now, line of treatment. Now, line of treatment depends on severity of symptom. There are three types, that is mild, moderate, and severe type of hyperemesis gravidarum. Many times, a female is having mild type of hyperemesis gravidarum, where only change in the diet can limit this condition. If it is moderate type, it shows biochemical changes. If it is severe type, it shows circulatory changes. So treatment depends on the severity of symptoms. In mild cases, only dietary changes are helpful. Now, according to homeopathy, homeopathy has a very good line of treatment for this hyperemesis gravidarum. Homeopathic medicines are totally given after case taking, proper case taking on the basis of totality of symptoms. We take totality of symptoms of the patient as a whole. We do individualization. Means whenever we have the symptoms, there are different remedies. Means if the one female is having arsenic, we cannot give a second female also arsenic, as we have to do individualization and then we select the proper remedy. According to homeopathy, whenever we take totality of symptoms, it is we consider her mental condition, then her thermal condition, whether she is chilly, she is a hot patient, and so on. Then we have homeopathic medicines like arsenic album, sepia, phosphorus, ipecac, nux vomica, symphoricarpus. Now I would just like to tell in detail about two medicine at least. See, arsenic album patient, she has nausea and vomiting immediately at the smell and sight of food. As madam told that many of female they are having trigger points like की मला स्वयंपाक करता करता फोडणी दिली की मला मळमळ होऊन लगेच उलटी होते. So that is the typical symptom. This we have in homeopathy. Many remedies are having this symptom. But peculiarity of arsenic is that whenever she is having this complaint, when we ask her whether she craves, whether she likes hot things or cold things, she wants hot things. But as soon as she takes hot things, as soon as it goes in the stomach, it gets cold, it is vomited out. Then the characteristic of vomiting is peculiar. So in this way, we prescribe our homeopathic medicines. Then sepia is again a different remedy. Phosphorus is a patient who wants cold things, but as soon as it is taken out, it reaches the stomach, it is vomited out. Then ipecac having nausea as well as vomiting. Then ipecac patient, many a times she has a symptom of nausea or may not have the symptom of nausea, but she is having immediate vomiting. And nux vomica patient. Nux vomica patient is the patient who is having the sedentary lifestyle. Nowadays, we see that many females are having sedentary lifestyle. They have the habit that they have to work 9 to 5 in the office. Then their dietary habits are different. They eat their food late at night, and all these changes causes vomiting. Then this may lead to constipation also. She might be by nature, she might be obstinate, and so on. So whenever we get such symptoms, we give nux vomica. These are few symptoms which I have told, ma'am. There are many symptoms which we take as a totality. We form the totality of that patient. We individualize all those symptoms and then we select the remedy. So in this way, homeopathy helps the patient. But many a times, there are certain limitations now. Whenever we give any kind of medicine or whenever we give any kind of treatment, there are certain limitations. With medicine, we also advise dietary changes to the patient, and these are must. Whenever we tell the patient when she gets up in the sleep in the morning, she should take dry carbohydrate food like biscuits, bread, or toast. She may take potato, rice, etc. And this leads to nausea and vomiting that is decreased. Then we tell her to avoid spicy and fatty food and take small food at frequent, that is small and frequent meals. As madam told that we की एकच चपाती किंवा दोन चपाती 2 वेळा खाल्ली पाहिजे, बाळाची वाढ होते. This won't apply in first trimester of pregnancy. We have to tell her as she could take small frequent meals, and she should avoid triggers like fatty food, स्मेलिंग ऑफ द कुकिंग फूड. बऱ्याच वेळेस ती सांगते की मला फोडणी देताना उलटी होते. तो अवॉइड ऑल दिस थिंग अँड डायटरी चेंजेस as well as homeopathic medicine, they are of great help in this condition. For if in some cases there happens that it is not under control with our medicine as well as dietary changes, or there are some biochemical and circulatory changes, we may need at times hospitalization and IV fluids are to be given. So that's all. Thank you, ma'am, for giving me opportunity. And I would like to congratulate Dr. Pooja. She has given a lot of points in her case. Dr. Padmaja Joshi madam, Dr. Rucha Guna madam, they have cleared most of the points. So I could tell with few points which were related to homeopathy. Thank you so much, ma'am.
Thank you so much, Shubna ma'am. But please stay with us for question answer session.
Yes, ma'am.
Now, Dr. Rizwana. She is professor from AGUM Unani College from Akkalkoa. Dr. Rizwana. Are you there, Dr. Rizwana? Okay, so let's continue the question and answer session. If you have any query, you can ask directly. And we are sending feedback link in chat box. Please reply to it. So if you have any query regarding hyperemesis or ANC, you can directly ask to our experts. Our experts are with us. You can turn on your videos for panel discussion. Yeah. Can we just one simple query that can we replace that biscuits and thari with Rajgira laddu?
Yes, yes, of course, ma'am.
Because it is
Very good. I just forgot it. Yes.
Yeah.
Yes.
And
It is rich in carbohydrates and no smell of fatty food and all.
and it may absorb that acids, extra acids.
It is also nutritious and it adds on iron content also.
And in Ayurveda there is you have told that laja manta
Yes.
to absorb extra acids, right?
Yes.
So it is also one of the kind of laja of Rajgira, right?
Yeah, and one more thing, if we medicate the laja with shunthi, that is ginger officially, that is dried ginger, it is easy to digest and it also affects the digestion and increases the appetite.
Okay. Okay, thank you. The next query from participants. In some cases, we can see that at the last moment also they are vomiting. So what can be done for that cases? Okay, there is one more query in chat box. Nux vomica is poisonous, then how we can use it?
Yes, Nux vomica is poisonous, but whenever we use homeopathic medicines, they are in potentized form. And when they are potentized, they do not act as a poison. Rather they act as medicine, and it is a very good medicine for nausea and vomiting during pregnancy.
Okay. Thank you. Is there any query? There is a feedback form in chat box. Please go through it and send us your valuable feedback. Thank you so much to all experts. And Dr. Pooja for nice case presentation. Dr. Padmaja Joshi for expert opinion from modern medicine. Dr. Rucha Ganu, expert opinion from Ayurveda side. Dr. Shobna Pandey, expert opinion from homeopathic side. Dr. Rizwana, are you there? Dr. Rizwana, are you there? Okay, no problem. So we can stop now. Thank you so much to all participants. Please give us feedback.
Thank you, madam, for the opportunity.
Thank you.
Thank you very much.
Thank you, ma'am.
Feedback.
Thank you. Thank you.
Shall we leave, ma'am?
Yeah, please give us feedback and then leave.
Thank you, ma'am.
Thank you. ओपन होत नाहीये हा होती
स्प्रेडशीट पण लिंक दिली तुम्हाला WhatsApp पे लिंक